Okay, fantastic. Thanks, Christina, for the introduction. I'm going to be talking today about something that we are just starting to do, so it's going to be a bit of a preview, and I come back in 3 years' time and I can tell you about the results. So this is a research project we've just had funded by the Health Research Council. We're about 5 months into a 3-year project at this point. I'm just going to give you a quick overview of the project and then walk through the individual stages of it. And then take questions, and obviously if you're interested in it, then I'm really keen to hear from people afterwards as well, either through questions or emails or whatever suits really. What we're interested in doing is thinking about different approaches to low carbon transport systems for New Zealand, and I'll talk a little bit more about that. So we're going to be creating a range of different scenarios. We're going to be then looking at what the types of policies are that we need to deliver these scenarios in the transport system. So the different scenarios will have different combinations and emphasis of the types of policies that they need, whether they're economic, whether they're infrastructure, that kind of thing. And then once we've got those all sorted out, we're going to then model what the health consequences are, the carbon consequences. We're going to be looking at some cost effectiveness, so we'll be putting in costs for the transport system, and then also looking at costs and cost savings in the health system of these different scenarios. And we're also going to be looking quite carefully at equity, both in the structure of how we model and the assumptions that we make, and also in the outcomes. I'm just going to talk a little bit more about each of these aspects. First of all, I think when we think about the transport system, there's just a couple of images. We've had a very high carbon transport system for the last 150 years. Everything that we have done, every assumption we have made has embedded this both physically, culturally, into everything that we do. Sometimes it's really hard when you're faced with that embedded nature of a system to really see that there might be an alternative. And I think that's particularly the case in transport. I know there's some work being done at the moment when talking to members of the general public about different approaches to transport. And it's virtually impossible for them to see anything other than cars as the way that we do things. So part of the work that we're doing around creating different scenarios is really trying to open people's eyes to the fact that this stuff was made, all the infrastructure and the cultural associations of transport were deliberate policy choices that were made, and we can make choices to do things differently. And this is, it's this idea, and in fact it's underpinned by this idea that transport, it can be normative social policy. It's just like any other form of social policy that we have. I think transport planners in general think that transport is not social policy, they think it's economic policy. And there's a real hangover from this predict and provide model of transport policy that we've had for the last 30 years. And what we're really saying here when we talk about visions that things can be different is that actually we can shape transport policy just like we shape other things. These are some examples of visions from a different project that was done in the UK. So these are not our visions, but what they did was these were visions for walking and cycling in 2030, and this group of people came up with a range of different approaches. Vision 1 is really implementing European best practice in the UK. This was a UK-based study. Vision 2 was a society that was very focused on egalitarian values. So people travelled much more by public transport than they would do now. It was perceived to be the most egalitarian form of transport. And Vision 3 was this highly energy constrained future, lots of walking. These those little things that you can see there are low speed electric vehicles. So they came up with these sort of different ways of thinking about transport systems. One of the key things they did was come up with these 3D images as well, so they could show people what they meant by them. And this is sort of what we're going to be doing, but for a New Zealand context. And the visions that we're tentatively thinking about at the moment, these aren't set in concrete at this point. Sorry about the pun, it's hard to avoid them in this area. Are a technology will save us vision. I have to say that that's a nightmare for me, but for a lot of people that is a vision. So that's basically that we're all just going to move, we're going to be exactly as we are currently, except we'll all be driving electric vehicles. Then this idea of health as a goal, so that our transport system is a really key, important determinant of health, even if it's not particularly recognised or talked about that way, and that health would be one of the goals of the transport system. So the whole transport system is configured to maximise physical activity, minimise injury, air pollution exposure, and the other minimise noise, and make sure that all of the health settings are as healthy as possible. And then the final vision that we're going to be looking at is a transport system that meets the aspirations of Māori. What would a transport system that was underpinned by the values of Te Ao Māori look like? And how could we think about that? And then once we've done these visions, which we're sort of in the process of working on with our advisory group at the moment on, we're going to be doing this idea of policy packaging. So we've got around about 50 low carbon policies. We've started with the International Transport Forum list of policy measures to move to a low carbon transport system. We're going to be adding some others in for good measure, because we're happy to talk about some quite radical policies that maybe aren't in common discussion at this point. And then we're going to group them up into which are the ones that are going to hopefully achieve Vision 1, Vision 2 and Vision 3. So obviously the one where technology saves us, the heavy emphasis will be on economic and push and pull measures around uptake of electric vehicles and removal of internal combustion engines. Vision 2 would be a much wider range of policies, including land use, heavy infrastructure policies, that kind of thing. I'm sure you can get the idea. Vision 3 are meeting the aspirations of Māori. I'm not sure what that looks like yet, so I'm not even sure where we're going to go with the policies. And then we are looking at reviewing the evidence for these, or looking for reviews of the evidence of these policies, and looking at figuring out whether there's evidence for the parameters that work in our model, which are really around, I'll talk about the model structure in just a minute, but it's really about mode shift and change in travel patterns, whether there's any evidence that these policies do that. And this is a reasonably substantial piece of work, but there are a lot of reviews out there already, so putting them into some sort of framework will actually be quite a useful piece of work in and of itself, I think. The model itself is a macroeconomic model, so what we look at is the impact of the policies on the transport parameters in the model, which are around mode, vehicle type, distance travelled and speed. Which then get converted into health risks around physical activity, air pollution, injury risk, and we're also hoping to add noise into that model as well. There's a big noise exposure bit of research being undertaken for New Zealand at the moment. We're hoping we'll be able to put that into the model. Those then feed through into diseases, and the ones in the boxes are with the white writing are ones we've already got in the model. And then we're hoping to add in some extras as well, particularly around mental health, because we know that transport is incredibly important for mental health, but we haven't looked at that previously. And then at the end we'll get health outputs in the form of health adjusted life years, and we'll get health system cost changes. Some of our scenarios will probably increase the health system costs, some of them will decrease them. Changes in transport system costs, look at change in transport emissions and equity impacts. The timeline around doing this is, it's a 3-year health research funded project. We're looking at the scenarios and the policy packaging at present. We're doing a whole lot of model work on updating and expanding the model. So we have an existing model, but we need to update a whole lot of the disease rates, the health system costs in it. And we're also expanding it to include hopefully noise and make our emissions part of it a bit more sophisticated. It's relatively basic at this point. And we're hoping that we will be able to start modelling our most straightforward scenario, which is the electric vehicle one, a little bit later into next year. And of course, I'm talking here today, but we've got a big team of people that work on this. Rhys Jones from the University of Auckland will be leading the work on the scenario of a transport system that works for Māori. We've got Mel McLeod, who is a modeller with a specialty in equity, and Anya, who is also a public health modeller, and then we've got Tony and Alistair, who provide various forms of input. And that's it from me. I'm happy to take any